Dr. Jess from Premier Physical Therapy. Thank you for watching our video series for Breast Cancer Awareness Month. One thing you might be asking is, why is lymphedema so common in individuals that have been dealing with or have dealt with breast cancer? Well, that's a valid question, and I'm hoping to help you understand why this is important. So the lymphatic system is a system that helps to filter fluid throughout our body and returns the fluid back to the heart. When you have cancer, they have to test the lymph nodes in your armpit in order to see if the breast cancer has spread to other areas of the body. This is 100% normal and must be done. But when this happens, it can lead to a backup of the fluid in the arm because of the lymph node removal itself. So here's an image of the arm, and then the vessels in the arm are the lymphatic vessels. And then here's where the lymph nodes are tested and removed. Why you care about this is because the vessels in the arm act as traffic throughout our body. The traffic must go through a toll booth. Nobody gets out. Everybody has to go through. When we have removal of lymph nodes, we can get a backup of traffic into the arm. Now, why would this progressively get worse? Well, the toll booth workers that are left, they now have been told they no longer get vacation days. They no longer get weekends off. They have to make up for, as best they can, the missing toll booth workers. So over time, if we don't help them, then they can start to burn out and quit. And that's when the stages of lymphedema can get worse and worse. So early detection means better outcomes. Here's an image of the stages of lymphedema. It starts off with no swelling at all, but you've got some diminished capacity. It progresses into the swelling is there, but then is gone by the time you get up in the morning, and then it progresses to the point where the swelling is there all the time, and then it can progress to the point where the skin is firm and fibrotic, the swelling itself becomes fibrotic, and that's where we get down to that last stage. Now, in treatment and physical therapy, what would we do for that? Well, evidence-based treatment is called complete decongestive therapy. So we've got two stages. The first stage is the decongestion stage, which is over here, which means we just want to get the size of that arm down, as close to the size of the other arm as possible. The way we do that is with compression. There's all sorts of alternatives for compression. Skin care, making sure that you really have good awareness of what is important and what is maybe things to avoid as far as skin care goes. We've got some basic exercises to help with just the health of the muscular system as well as the lymphatic system. And then we also use a technique called manual lymph drainage, which is a hands-on technique that helps stimulate the lymphatic vessels. Once we get the size of the limb down, we then progress into the maintenance phase, because this is something that does not go away, so we have to constantly maintain it, which is very possible for you to do with a home program. You have self-manual lymph drainage or potentially a pump. So that's where we have the manual drainage for home. We've got skin care, which is important always, exercise, which you would be educated about, some very easy basic exercises, and then also potentially a form of a compression garment for long-term use. So this is what we do with lymphedema, and this is why it's really important, and it's very easy to address, and is not painful, which is great. So if you have any questions, or would you like to learn a little bit more, or potentially come in for an appointment, please see my contact information below at the bottom of the email. Thank you.